Hello everyone, we're going to talk about coarctation of aorta, which is an congenital disorder. This causes narrowing that usually occurs in the thoracic aorta, just beyond the subclavian artery. Primary physiology disturbance caused by coarctation of aorta is high resistance to flow in aorta. So this is subdivided into two parts. This is based on location of ductus arteriosus. What is ductus arteriosus? This structure shunts blood in utero. Ductus arteriosus is maintained in utero by decrease in oxygen and increase in prostaglandins. Prostaglandins, which is secreted by the placenta. At birth, what happens is there is detachment from the placenta. Therefore, there is increase in oxygen and decrease in prostaglandins, which causes functional closure within 18 to 24 hours after birth, and this occurs due to smooth muscle constriction. Anatomical closure occurs in few days or in few weeks, and this structure becomes ligamentum arteriosum. This happens to be one of the important structure in the fetal circulation. Coming back to our subtypes, we have preductal, which is also called as infantile type, and we have postductal, which is also called adult type. So let's discuss about preductal type. It's called the preductal because it's narrowing before the ductus arteriosus. Infantile type because the blood in the ductus arteriosum are supplied to the lower extremities despite the narrowing. So there is poor development of collateral vessels due to the adequate blood supply via the ductus arteriosum. So what I'm saying is the ductus arteriosum is helping in delivering the blood to the lower extremities. Therefore, there is no development of collaterals in utero. At birth, the blood does not go through the ductus arteriosum but flows through the lungs. Hence, the babies are born with lower extremity cyanosis due to deoxygenated blood to lower extremities. Hence, there is early symptoms developed. Therefore, it's called the infantile type. After complete closure of ductus arteriosum, symptoms are developed because all blood flows through severely narrowed aorta. Closure of ductus arteriosus causes abrupt increase in afterload, increase in left ventricular and diastolic pressure, acute heart failure, and when the left ventricle dilates, which causes failure and leading to shock. So like about 5 to 10% of Turner syndrome have coarctation of aorta, especially infantile type. Moving on to the next subtype, which is the postductal or the adult type. It's called the postductal because the narrowing is right after the ductus arteriosus. In this situation, the ductus arteriosus does not supply lower extremities in utero. So therefore, there is formation of collateral vessels. Due to development of collaterals, this may go undetected until adulthood. Hence, it's called the adulthood type, where symptoms developed during the adulthood. Let us discuss about the symptoms. So, in the lower extremities, there is decrease in BP, so which leads to increase in renin release, which causes saltwater retention, vasoconstriction via increase in angiotensin II, weak pulses, which causes brachiofemoral delay. Whereas in the upper extremities and head, there is increase in BP, which is a cause of secondary hypertension. Moving on, let us discuss about the Key association with coarctation of aorta. So we have bicuspid aortic valve, which is found in 60% of coarctation of aorta, where normally there are 3 leaflets, but in this case there are 2. Next we have intracranial aneurysm, which is called the perianeurysm, which is found in 10% of the people. Let us discuss about the signs and symptoms. Firstly, we have the hypertension in arms, then murmurs over back between the scapula, weak femoral pulses, pain with walking, which is called claudication. Why does claudication occur? This is due to poor blood supply in the lower extremities. Let us discuss about the X-ray findings. So first thing we see will be the rib notching. What is rib notching? Why does it occur? It occurs due to increase in pressure above the coarctation. Intercostal vessels enlarge to carry blood around obstruction. Therefore, these vessels bulging into the ribs causes this appearance. Next, we have the 3 sign. Before and after coarctation, the outline resembles the number 3. Therefore, the 3 sign. So when you look into the X-ray, you can see a curve which is seen below the ribs margin. That's because the vessel has been enlarged. When you see the 3 sign, you can see number 3. That is because of narrowing. Next, we talk about the physiology of coarctation of aorta. So what happens during the physiology? First thing is autoregulation. Autoregulation helps to maintain regular blood flow. In the upper extremities, there's increase in BP, which leads to increase in flow. Arterioles limit the flow by constriction. Then there's something called local effect. Then we have resistance to flow, which is high. Next, in the lower extremities, there is decrease in BP. So the arterioles dilate, which helps to increase the flow. Why does this autoregulation happen? This happens to maintain normal upper and lower perfusion despite the high and low pressures. Let us talk about the complications. The complications would be heart failure. This occurs due to pressure overload of left ventricle. Then we have aortic rupture or dissection. Then there is increased risk for endovascular infections. This infection is caused due to high or low pressure across narrowing, which can cause endothelial damage. Low pressure distal to the narrowing can cause bacteria to attach easily.